Good morning, everyone. My name is David Ivanov, and I'm an undergraduate here at UC Davis, as well as the Director of Medical Programming for the 12th Annual UC Davis Pre-Medical and Pre-Health Professions National Conference. I'd like to first thank the AAMC for sponsoring this event and making it available live across the globe. Our next keynote speaker is an accomplished surgeon, gastroenterologist, and prolific medical researcher, particularly in pioneering interventions for treating pancreatic lesions. He has held numerous other titles and appointments, including editor-in-chief of the journal Surgery. He is renowned for being the longest-serving chair of surgery at Harvard, where he has trained over 2,000 surgeons. As chair of the surgery department, he was recognized for promoting fairness and equality for the underrepresented. He is also a national advocate for improving patient safety and clinical effectiveness in surgery. Aside from his professional achievements, he has channeled his spirit of generosity into a volunteerism program that later became known as Operation Giving Back at the American College of Surgeons. It is my honor and privilege to welcome the President of the American College of Surgeons, Dr. Andrew Warshaw.
Thank you, David, and thanks for the opportunity to speak to you, to address you, and to tell you something I think a little bit different than what you may hear in other parts of this incredible collection of pre-health students. I sat through the dean's presentation in the last session, and I must say I couldn't have set it up better, because one of the major themes that came out of that was what to do with a gap year. So think about what I'm saying, perhaps as an answer to that question. I'm sure I don't need to tell you that we are very, very lucky to be in this country. That even though you may come from very different circumstances, from very diverse backgrounds, from different countries, the fact is we've got it pretty good here. And we have the opportunity to pay that back. We won the lottery, but now we can pay it forward. You have the opportunity now, not just later in your life when you've already become a physician, a dentist, a nurse, a pharmacist. You can do it now. And that's sort of what I want to tell you about the opportunities that are out there. So I'm a surgeon, as you've heard, and that gives me a particular perspective, a particular view, a bias, if you will. So much of what I'm going to tell you has that particular bias. But it's not only about surgery. The fact is that there is an enormous public health gap, deficit around the world. That these figures are extraordinary. They are about surgery. And part of the purpose of this particular list is to tell you that even though Ebola is in the news now, even though HIV, AIDS, and TB and malaria are principal focus of the World Health Organization and problems within our inner cities, the fact is that there is an enormous surgical burden of disease. There are 2 billion people on this planet who have no access to surgical care. In the United States, there are 49 million people who live in what we are calling surgical deserts. There are no surgeons within reach. Trauma continues to be a major cause of medical need. Of course, cancer, we know that. Maternal deaths, not such a big deal in this country, but around the world, an enormous problem. And there are 56 million people in Africa, for example, who have a surgical condition needing treatment for which they have no access. Basically, 1/3 of the world's population receives 3.5%, 1/10 of the surgical care worldwide. So David mentioned that I became interested in volunteerism by surgeons, since that was the field I was working in, some years ago. And let me just say there are different kinds of volunteerism. You can go abroad and you can go to some some incredible places, challenging places, and it's a different kind of practice entirely. Or you can do it in this country, because right in your backyard, there is tremendous need for care in our inner cities, in our rural areas, where the deserts of medical care exist. So I got interested in what actually was going on and why people were doing it. And there are a number of organizations that actually help you get involved in volunteer medical care, not just surgical care. And some of these have to do with sort of national origin. Some of them are faith-based, based on religious organizations, church-sponsored, and some simply are people who want to go back to the countries from which their ancestors came in order to provide for those populations. So about 15 years ago, I got interested in trying to codify that, to find out what was really out there. And through the American College of Surgeons, we formed an organization which was called Operation Giving Back. And these volumes, which were accumulated over a few years, they're reports, basically were intended to show how many surgeons were doing what. Again, this is surgery, but what and where they were doing it. And what we found was that there was an extraordinary group of organizations that were out there, most of which I had never heard of at that point. And they may have been very specific, like plastic surgeons who are reconstructing faces, eye surgeons who are doing cataract surgery around the world, or simply going into poor areas of Haiti or other countries and setting up clinics. It's almost anything that you might be interested in, and at this point in your careers, it doesn't matter, just do something. That gap year can be put to enormous benefit and good use. But it is not just in the jungles that we're talking about. There are these needs that are all over our country. There are people who have no access to care, and there are doctors and nurses and pharmacists and dentists who are providing that care, as I would put it, out of habitat, out of their habitat, out of their natural uniform, and in circumstances where they can give back to people who desperately need it. So let's start talking about some specific examples, because there's some great stories here. There are some really inspiring things. The burden of surgical disease we talked about, that 2 billion people around the country have no access even if they get hurt. The poorest 85% only get 15% of surgical care, and 11 to 15% of worldwide death and disability is not from old age, but it's from surgically treatable conditions that could prevent that death. So just to give you some idea of how that looks, injuries, 38% of those, malignancies, congenital abnormalities, but complications of pregnancy, 6% of the major morbidity and mortality in low and middle income countries. Cataracts, think what happens in those areas if you can't see. But if you could see, how much difference it would make for your livelihood and your family. Now, let's get down to you, because you might assume that that care is only being given by surgeons, for example, but it's not. Much of the care given in these circumstances are given by non-physicians, non-professionals, by volunteers, in China, we used to call them the barefoot doctors, but there are all kinds of variations. Out in the villages, they may be shamans, they may be spiritual healers. So what can you do? You actually have the opportunity to get involved in that. You can see medicine practiced in a totally different circumstance than it is here on the campus at UC Davis. You can deliver medical care where they desperately need it. You can begin to understand what underserved populations need, learn how their culture, their religion, their economics and poverty, their needs determine what is possible. And that becomes really important, because the medicine of tomorrow will be the same as today, no better, if we don't do something about it. And that means bringing research, bringing a question, a problem that needs to be solved. So let me give you some stories. Johanna Riesel is a surgical resident in my program at the Massachusetts General Hospital. This experience that she's talking about, this feeling that she had, was not developed while she was a surgical resident. While she was in college, she had this calling, if you will. She had this feeling of need for her to do something over and above. So her gap year, the gap year that you've just been hearing about, was spent in Africa. It was spent in Liberia, as it happens. Maybe not where she would go today because of other problems with Ebola, but that's where she went and where she taught. She taught students there. She taught caregivers there. Even at that point, she had knowledge that they did not. And she wanted to be part of changing that, and was. And that has stayed with her. So she now has a Master of Public Health, which she has obtained during her surgical training, and she is a Global Health Fellow with Paul Farmer and continues to work with the Lancet Commission on Global Health as she is training in surgery. This is Johanna's comment, and I'll give you a moment just to look at it because I find it extraordinary. I find it inspiring just to know that my students are thinking like this. So here's another story. Amazon Promise is an NGO, a non-government organization, which is run by, as it happens, in full disclosure, it's run by my daughter, who is a physician's assistant, who had many of the same feelings that Johanna did, and she felt that she needed to do something other than her daily life as a physician's assistant in Boston, where she's terrific, incidentally. So Abigail got involved with this organization, and her comments are here. And again, I'm not going to read it to you, but really, it's the theme that you learn from your kids. I learned this from my daughter, that she felt, and I'm very proud of it, that she felt that she had to give back, that it wasn't simply good enough to have been born in Boston, raised in Boston, in a relatively privileged circumstance. So Abigail got involved with Amazon Promise, and this is Belen, which is a slum at the mouth of the Amazon. Their clinic is there, their headquarters is there, and they serve this population. But in addition, I'm sorry, this is Belen. In addition, they take teams of students, college students, medical students, other pre-professionals, anybody who's willing to go. You could be a lawyer if you wanted to do this, gosh forbid. But they go upriver on the Amazon to reach villages that otherwise have seen no medical care of any kind for perhaps a year. And they go to work with the local health professionals, who may be shamans, to teach them as well as to deliver medical care. Some of these villages are difficult to reach and have to go by dugout, and they kiddingly call themselves the dugout doctors as they go into the jungle to reach these villages. Here they're being welcomed at one of these villages that has had nobody there for a year. Now, why would they show up there? Isn't it dangerous? It could be, but this is done through the Ministry of Health that determines which villages want this help. And so they are, in fact, welcomed as a team to do this. For those of you who may be pre-pharmacy students, this is the pharmacy being set up. It's a little different than what you might see by the automated pharmacies that we have on campus here. But basically, they've packed all their medicines in, set them out on a table, set them out for what they could reasonably provide, and these students are there as the pharmacists in this case. This is a list of the medications, which, although there's some trivial price attached to it, these medicines are not normally available in the villages. They are all donated by companies that make them, and they are given free to the people in the village. So this is truly free service. I'm sure you've all been in a hospital or a doctor's office and been at the reception desk and had somebody with a computer signing you into the electronic health record. This is the reception desk in this village. It's again manned by the team of students, of pre-health, students of all kinds, and people come in, they tell them what the problem is, and they're set up for the visit. Much of this has to do with very minor wounds, essentially putting Band-Aids on things. I will not show you some of the more grisly pictures of people who had a snake bite and walked 3 days to get to the clinic. By the time they got there with a gangrenous foot, things were really, really bad. But much of it is at the level where you can be an important part of caregiving. And think of it, you're the only ones. This happens to be my daughter. She's taking care of a kid here, but when you take care of the kid, you wind up taking care of the whole family. Everybody's there. They all have some problem that they're bringing, and this is an opportunity to seriously make a difference. Heidi Moline is a student at the University of South Dakota, and this is her comment. I love this, and I'll tell you why even more in a moment. But it was a perfect blend of public health and medicine that she was looking for. But look at this last sentence. Your time will be hot, wet, physically challenging, probably diarrhea-laden, and richly rewarding beyond pleasure. Dean Freischlag this morning was talking about the quotes that she loves, so here's one that I love. And think of how it resonates with what Heidi just said. This was in 1914 when Shackleton was recruiting for the Antarctica expedition. He said, "Men wanted for hazardous journey, small wages, bitter cold, long months of complete darkness, constant danger, safe return doubtful, honor and recognition in case of success." I think it's a little better under the circumstances at which you might be going, but think of it. So again, a comment from Abigail, and this is a haunting comment. She says it haunts her, but it haunts me as well. And the bottom line is, there is no one else. No wonder I feel guilty leaving. So what I'd like to do now is show you something a little bit different. And this is a video clip that shows you what students can do to bring new information to these
Harvard.
areas.
Every student, regardless of whether they're Harvard students or non-Harvard students, will get Harvard summer school credit for the course. And it's all for a letter grade.
So the program is a Harvard program, but it has students from other universities. And so it's been eye-opening, not only in being here in Kenya and trying to open our eyes to something that's completely foreign to us, but also in learning from other peers.
At Child Fund, we are starting a program called the Kids Program, which focuses on improving childhood health and education. So the first component of the program is a children's picture book, and it's called The Wild Health Herd. And it'll be a 3-set book, the first book being about malaria, the second book being about germ theory, and the third book being about childhood nutrition and wellness.
When we were drawing the animals, it was funny because they said, wow, in America they teach kids how to draw. Look, they can draw. They spend time doing this. And that was just sort of an eye-opening moment for us because we realized that a lot of schools here focus a lot on memorization because they don't have books. Once they learn about malaria through the animal characters, they're going to do the race to the net game where they learn how to use the net, and it's sort of like tag.
We were assigned to work with Nyanza Reproductive Health Society.
Our project is to come up with and implement a device that will sustainably and inexpensively help recruit men for voluntary male medical circumcision and help reduce the spread of HIV across the Nyanza province of Kenya.
Our component is of developing a device is like a rudimentary redesign of a jockstrap, basically. And we are searching for a material that could be absorptive and providing more comfort for the wound after circumcision takes place. And so Keynote is the main producer of reusable female sanitary napkins. And we thought that would be a perfect material. But the trick is obviously advertising a female sanitary napkin to a male audience in a male-dominated culture.
And if you're in Boston trying to solve this problem, you're going to solve it from an American point of view and say, here's the latest technology. This works great here. I'm going to send it over and it's going to be super innovative in Kenya. That wouldn't work. That would be a complete flop. And that's why our projects have been so challenging, because we kind of had to take off our American goggles and try to approach the problem from a way that we've never been raised. And the friendships that everybody forms in this group they're not superficial friendships, because everybody here really cares about making a difference, whether they're pre-med or government majors or want to be lawyers. They're getting something very meaningful about this from this experience.
Coming to Africa on this trip was like the perfect mix of entertainment and education. You know, like we're learning so much and we're learning every day, but it's nice to kind of step out of the classroom and, you know, do the traditional tourist thing for a little bit.
So let me give you one more example. And the problem here is the fact that in Africa, 70% of pregnant mothers suffer from malnutrition. They also do not make use of access to medical care, even if it is available. So the students taking this problem, devised another solution, and they created a product called Nutrimama, which is an enhanced food supplement, which was then made available to the patients and the pregnant ladies in this area. So they made it out of cheap stuff that was readily available and compounded it into this material, which was a food supplement. And the trick here was that they got double benefit out of it. Number one, they improved the nutrition of the population, the nutritional gap caused by pregnancy, but also you had to come into the clinic to get it. So it got them the rest of the prenatal care as well. So it was then, again, packaging became important, how one presents it. It was done with this kind of feminine packaging, and they actually created a profit, because once they had it, they sold it to other organizations, other NGOs, which were able to propagate the program. So we now need to think of this not simply as a gap year where you go off and have fun, not even only as a gap year where you do something good and bring something good to other people, but you're enriching yourself, preparing yourself, but also you have the opportunity to answer questions, to improve the care, not just deliver the care, but to improve the care at these sites where you go. There are lots of things that are needed in these areas. What is the appropriate kind of care? You're not going to bring laparoscopic equipment or an electronic health record to the village up on the Amazon, but there are things that you can bring, there are things that you can do, and in this world you need to think in terms of cost effectiveness. You need data. And currently there's something called the Lancet Commission on Global Surgery, which is gathering that data, trying to figure out exactly what is needed in different environments, and integrating your care, volunteer care, into the systems of care. You can't simply drop in on a parachute, do something, and leave. There has to be something that is sustainable, and that means training the individuals who are there and who will be left behind when you leave. So I'm going to leave you with questions for yourself. As I have spoken with medical students, aspiring medical students, aspiring trainees for surgery in our program, it's absolutely extraordinary. Your generation is different. It is different than mine. We just had, sort of tunnel vision. We went from college to medical school to whatever else we were doing, and none of this really was on our radar screen. I would say that probably close to a third of the students who are applying for our training program have already done something like this. So this isn't something rare. This is something that's common. This is something that you can do if you want to. And so the question is, do you want to? And when you ask yourself, why would I want to, here are some of the answers that people have given. And basically, it's what resonates with them. It's what one of the deans in the last session said, what do you love? What do you find that you love? And this could be part of that. So as a final quote, there is a surgeon who runs a free clinic in her spare time, which is growing. That is, her time away from her practice is being spent more and more delivering care from a double-wide trailer in Tampa, Florida, to people who absolutely cannot pay for any kind of care. And Sylvia Campbell said this, we've been talking about jungles largely, but you don't have to go outside your own community to find a jungle in which you can give back, in which you can be a part. You can do it this year, you can do it next year, you can do it during your gap year. Just remember, you can do it. Thank you.